All right, let's dive into one of the most fundamental, most essential interventions in all of medicine, oxygen therapy. Now, it might sound simple, right? Just give someone oxygen. But as we're about to see, there's a delicate and absolutely crucial partnership at play to make it work safely and effectively. Let's get into it. So let's start at the very beginning with a basic question. Every single cell in your body, from your brain to your toes, needs a constant supply of oxygen. It's the fuel that keeps the lights on. But what happens when that fuel supply starts to run low? Well, the result is a condition called hypoxia. And let's be clear, this is the villain of our story today. When there's not enough oxygen, cells literally begin to starve. And that quickly spirals into organ dysfunction. If you don't fix it, and fix it fast, it becomes life-threatening. This is a full-blown medical emergency. But, like in any good story, where there's a villain, there's a hero ready to jump in. In this case, it's a treatment so common we might almost take it for granted, but one that pulls people back from the brink every single day. And that hero is, of course, oxygen therapy. The definition is really straightforward. It's just the process of giving a patient oxygen at a concentration that's higher than what we're breathing right now, which is about 21%. The goal is simple: flood the system with what it's missing and get that vital fuel back to those starving cells. So what's the mission plan here? What are we trying to achieve? Well, first and foremost, you want to correct that low blood oxygen. You also want to make breathing easier on the patient and take some of that strain off the heart, which has been working overtime. The magic number we're often aiming for is an oxygen saturation of 92% or higher. That's the zone where we can prevent that terrible organ damage. You know, a hero is only as good as their toolkit. And when it comes to oxygen therapy, there's a whole array of tools or delivery systems, each one designed for a specific job. Let's look at the two big categories. Okay, so things fall into two main camps. First, you have your low-flow systems. Think of these as giving the patient a little boost of oxygen on top of the air they're already breathing. Because of that, the exact percentage of oxygen they get can change with every breath. On the other hand, you have high-flow systems. These are the precision instruments. They deliver a fixed, exact concentration of oxygen, we call that the FiO2, no matter how fast or slow the patient is breathing. This is a great little cheat sheet of the most common tools. That nasal cannula, that's your comfortable, low-flow option, great for stable patients who just need a little support. The Venturi mask, that's a high-flow workhorse. It's fantastic for patients with conditions like COPD who need a super precise oxygen dose. And then, the non-rebreather mask. That's the big gun. You bring that out in an emergency when you need to deliver a massive amount of oxygen, fast. Okay, so we've spotted the problem, we've brought in our hero, we've picked the right tool for the job, and the patient's oxygen levels are on the rise. We're done, right? Mission accomplished? Well, not so fast. It turns out that the medical-grade oxygen coming from a tank or a wall outlet has a hidden flaw. It's incredibly, incredibly dry. And this introduces a whole new complication to our story. I love this analogy because it is just perfect. Pumping dry, unhumidified gas straight into someone's lungs is like forcing them to breathe a harsh, dry desert wind. It completely bypasses your body's natural humidifying system in your nose and throat, and it can quickly start to cause some real irritation and discomfort. And this is where our hero gets a sidekick, a really crucial partner in this mission: humidification. It's a simple but vital process of just adding water vapor, moisture, to the oxygen before it ever reaches the patient. This simple step protects the airway and makes the whole experience so much more comfortable. So when is this sidekick absolutely mandatory? Well, the clinical guideline is actually pretty easy to remember. Anytime a patient is getting oxygen at a flow rate above 4 liters per minute, that's the magic number, humidification is considered essential to stop those airways from drying out. Okay, so let's put it all together. How do healthcare providers actually put this life-saving duo into action at the bedside? Well, they follow a really clear 4-step plan. The whole process is methodical, and it's all about patient safety. Step 1, assess. You check the patient's airway, their breathing, and of course, that oxygen saturation, the SpO2. Step 2, prepare. You get all the right gear ready, the right mask, the tubing, and the humidifier if it's needed. Step 3, apply. You put the device on the patient and start the flow of oxygen. And finally, and this is arguably the most important step, monitor. You have to constantly watch the patient to make sure the therapy is working and not causing any new problems. Now, even the best heroes and sidekicks have to be aware of the dangers on their mission. And oxygen therapy, as life-saving as it is not risk-free. There are some serious complications to watch out for. This is so important. Oxygen is a drug, and you have to respect it. Too much oxygen for too long can actually damage the very lungs you're trying to save. That's oxygen toxicity. There's also this weird thing called absorption atelectasis. Basically, the nitrogen in normal air helps keep your tiny lung sacs propped open. If you flush all that nitrogen out with pure oxygen, those little sacs can collapse. And of course, we've talked about the drying effect, and we can never forget the massive fire hazard. Oxygen itself doesn't burn, but it makes everything else burn like crazy. Okay, let's zoom in on one of those risks in particular, CO2 retention. This is a huge deal for patients with chronic obstructive pulmonary disease, or COPD. For these folks, giving too much oxygen can be uniquely dangerous. So what's the single most important precaution you need to take? The answer is all about precision. For a lot of COPD patients, the goal is not to push their oxygen saturation up to a perfect 100%. Instead, you're aiming for a very specific, carefully controlled range of 88 to 92%. This gives them enough oxygen to live, but not so much that it switches off their body's natural drive to breathe. It's a delicate balancing act, and it's exactly why those precise high-flow devices like the Venturi mask are so critical for this group. So as we start to wrap this up, we really come back to our central theme. This isn't just about the hero, oxygen, swooping in to save the day. It's all about a perfectly balanced, life-saving partnership. In the end, it's pretty amazing when you think about it. It's just a simple gas and some water vapor. But when you put them together correctly, this partnership becomes one of the most powerful and essential tools in all of medicine, protecting our body's most critical lifeline. It's a great reminder that sometimes the most profound interventions are all about getting the simple principles of care exactly right. Thanks for joining me.